Okay, let me finish and talk about health care. If you're happy to say cap and trade. Let me talk about the health care bill.
I have a cap and trade question.
We'll get to all the questions later. All the questions? Well, you know, if people would actually show some respect, we would have time for doing it. Because we will still run out of time at 7:30. This is the health care bill. It's 1,017 pages, and I'm on the subcommittee, and we've dealt with this for many months. So people ask if I read the bill. Believe me, I read it, and I read every amendment that we tried to put on and get it out. And it came out of the committee last Friday night about 9 o'clock on the Energy and Commerce Committee. And there's a lot of issues in the bill. But the goal of the bill is to provide some type of health care coverage for everyone in our country. Because right now, and the reason I'm a supporter of the bill, is our district, and some of you may have picked it up outside, there's been an analysis of our district, and we're not a wealthy district. We've never been. It's a working folks district. We have 243,000 people in our district who don't qualify for health care through their employer, through Medicaid or Medicare. And if you live in our district, you know we have a lot of seniors that are on Medicare. So you take all the seniors out, but we still have 243,000 people. Health care has been an issue in our district long before I got to Congress. I fought it when I was in the state legislature, and the same now, to try and give coverage to people. In the early 1970s, we actually had 80% of the folks in America were covered by employer-based insurance. Now we're at 60%, and they expect it to go even lower. So I've been fortunate in my adult life to have employer-based insurance, whether the printing industry, when I was a health guy. So, you're welcome. But in Congress, I'm under the same health care plan that every other federal employee has. And so, and we pay but in the plan, so what this would do, the bill was designed to shore up employer-based insurance. Because, speaking of the Shell refinery, the Shell CEO 3 years ago told me that they were moving some chemical jobs from our district to the Netherlands for two reasons. The price of natural gas of North Sea at that time was cheaper, a little bit. But he said the biggest issue was that the price per employee at Deer Park Shell was more expensive than the Netherlands. And Shell is a multinational company. They actually are headquarters in the Netherlands. So they move those jobs. And so that's why this bill has support of a lot of different groups that want to try and deal with our problems we have in our country with health care. Both the high cost that's going up every year and the number of people who continue to not have access to it except through the emergency room. And so that's the goal of the bill. The goal of the bill is to provide something, whether you're employer-based or a co-op on a national basis, that would build on what we've done. Because, again, most of our industries in our district are under federal law anyway. If you get a policy written under state law in Texas, that's controlled by the state legislature. But if you get a policy that's multi-state, it's under ERISA. It's been a federal law for decades, and it's under federal law. So we're trying to build on that success of having a multi-state regulation to have it. So it'd be cooperatives to be able to get in there. I don't know if cooperatives work. The state of Texas has tried that, and a lot of states have tried, and with real limited success, because you still have problems. If you have an illness and you go to that cooperative, they're going to charge you based on your illness. If you have hypertension, if you're diabetic, you name it, they will charge you for that. So the bill also prohibits insurance companies from excluding you because of your pre-existing condition. And although the insurance industry actually announced they would quit doing that in anticipation of this bill. So, but the goal of it, and the other part of it, is that if we can't do it with cooperatives, the House bill has a public plan in there that would kick in. As soon as you get through responding, I'll be finished. We get the question. But it has a public plan, because having dealt with insurance, both as a regulation, in the state and on the federal level, the private sector can't cover folks that have terrible illnesses because they have to price it so high people can't afford it, because they have to make a profit. You know, Blue Cross Blue Shield, Aetna, those folks are not non-profit. and so they have to make a profit. So there, if you have hypertension, okay. Look, if you want to stop talking, you will get your questions, or at least somebody will get them. But I'm not going to yell over you. And if you don't show me the respect, then obviously you must not be from our district, because I've had these town hall meetings for 20 years, and I've never had somebody disrupt like we've had it. And the night's fairly tame, but we're not going to get any worse, because otherwise we just won't have them. And my constituents won't get, they'll have to call me on the phone. So let me talk about it.
I will call, yes.
Well, I'm glad you called. But, so anyway, the goal was to have something as a backdrop that would be a public plan, and it's not new. We've had Medicare since 1965. The reason Medicare was...
And it's bankrupt. Let him talk. Let him talk. As soon as he finishes talking, we can start answering questions.
Can we say he gets a half hour? We get a half hour? That's all I'm saying. He gets a half hour.
Look, this is our town hall meeting. We've done them. And you've only been here once. You know, I'm sorry. I try and speak for 15 minutes and have 45 for questions. But if I have to stop every time somebody wants to move, and I'm going to, so maybe you ought to settle down, and everybody should, and we'll get going. But the reason we need a public plan is because just like Medicare was created because seniors couldn't get health care. And it was created in 1965. Now, we have Medicare Advantage, which is the private sector. We have lots of programs that are federal insurance programs. How many of you have flood insurance on your home? That is a 100% federal flood insurance program, because State Farm, Allstate, all of those folks could not afford to come out and insure us in our area, because although not in the last few months, we normally flood pretty good. So that's why it's a federal program that was created. So we have had experience on the government level. And the flood insurance program, again, pays out billions of dollars, but it also collects our premiums, because I buy flood insurance too. So we have that experience. This bill came out of committee, and it probably won't be voted on in the House until late September, because 3 of the House committees dealt with it. And sometime after Labor Day, we go back. The Rules Committee will work together and try and pair all the 3 versions of this bill, depending on the jurisdiction of those committees. And that will probably take a week or 10 days at least. We might be lucky if there's a vote the 3rd week of September. It's probably going to be the last week of September. Now, that's the House side. We have 2 branches of Congress. And the Senate's working on their own, and there's not a public plan in the Senate bill. They have a cooperative. The problem is that I want to make sure that Congress doesn't have to go back and revisit something, because if the cooperative doesn't work and cover people, then if we still have 47 million people who are uninsured, and in our district 243,000, there's still going to be a lot of pressure to find something that will give people access to health care instead of showing up in the emergency room. So with that, I can talk about the bill. If you have questions on pages and lines, believe me, I can. I read it, and we amended some of it and moderated some of the original bill. So